Hey guys, it's Dr. Jason Emer, board certified dermatologist and body contouring specialist from Los Angeles, California. We service West Hollywood and Beverly Hills. We treat everybody with the most advanced technologies for skin rejuvenation, scarring, pigmentation, and you guys know me on Instagram, TikTok as doing a ton of body transformations, our Gladiator and our Supermodel Lipo. I'm here today in Orlando, Florida with Aesthetics Biomedical, talking about Plasma MD or Plasma Pen. It's one of my favorite, newest technologies for skin tightening. For years, and I've been doing this, even though I look really young, I've been doing this for about 15 years, and I'll be about 7 years in Los Angeles. There has not been a low downtime treatment for crepey skin, for fine wrinkles, for discoloration that didn't have a lot of side effects or required so many treatments. What we had over these past years was strong lasers, chemical peels, and then fractional lasers and microneedling radiofrequency came to the market and gave us some improvement in texture and tone, but they really didn't help the crepey wrinkles around the eyes, those fine wrinkles around the mouth, what we see on the neck, elbows and knees. So many of my clients are asking for not only off the face rejuvenation, such as the elbows, knees, and buttock, but also down under rejuvenation in the vaginal and genital areas. So treating wrinkles in those areas, treating tightening of those areas. Plasma energy is one of the lowest downtimes, very specific treatment that I can combine with lasers, with skincare and peels. I actually developed my own skincare line called Emer Skin. Everybody knows it from online. It's doing extremely well. Thank you so much. Our Aerify Complexion Revival Peeling Kit was designed with an illuminating mask that we actually place on right after doing the Plasma Pen to help decrease the risk of post-inflammatory hyperpigmentation, help the wound healing process with our peptides and our growth factor serums that are in there. And then in Emerald Skin, we have the AOX-C and our vitamin and our Hyla B, which are both our vitamins, our botanicals, and our hyaluronic acid to help rejuvenate the skin. Patients really want improvement around the eyes. One of the first things they notice in their 20s to 30s, and you know, so many more clients are coming in doing pre-rejuvenation much earlier, doing treatments for aesthetic improvement, to keep themselves looking young. Now we're seeing those patients in 20s, 30s, and they don't want as much downtime. So we're using Plasma Pen with less lasers and peels to really get a strong amount of rejuvenation. And today I'm here in Orlando. I'll be showing some of these amazing combinations, things that nobody ever does, combining peels and Plasma Pen, combining fractional laser and Plasma Pen, combining ablative laser and Plasma Pen. So we're going to see non-ablative, ablative, and peels combined with skincare, because that is the trend right now. Combination therapies for better results, patients coming in much younger for pre-rejuvenation, and those wanting off-the-face treatment. So we will show neck results, chest results, elbows, knees, and down under. So thanks for having me here, you guys, today. I'm super excited to talk about plasma resurfacing, fine pinpoint skin tightening that you can do literally with minimal downtime in your office, a small pen, and it doesn't require a lot of pain, anesthesia, or cost. A lot of patients are coming in because they see trendy things on Instagram, they see trendy things online. Plasma Pen looks really cool. It has all these little dots. It stimulates people to ask questions. The issue is you can't treat large areas with it. So lasers, peels, microneedling radiofrequency are still going to be a staple treatment for collagen production, for global overall anti-aging, sun damage, fine wrinkles. But what I find is we can combine the Plasma Pen to small areas that really bother people. Frown lines, smile wrinkles, sleeping wrinkles, eye wrinkles. Those may be a little bit more mature that have a lot of wrinkles around their mouth. We can combine the Plasma Pen with the laser. There are a lot of low downtime lasers and low downtime microneedling radiofrequencies, such as Vivace, which we're talking about here today in Orlando. That's going to give you collagen production. It's going to tighten the skin and improve texture, but it requires many treatments. With Plasma Pen, although it does require treatments over time, you see a very robust response initially. So if somebody has individual wrinkles that bother them, or scars, or even small areas of wrinkling under their eyes when they smile, and Botox is not improving it, microneedling and lasers are not, we can add in the plasma pen and get a really good result. So some are coming in asking directly for the plasma pen alone. Most of the time we're getting them on a full global anti-aging plan that includes plasma pen as part of it. So I see every day some patient come in with burns, scars, little dots on their skin, or hyperpigmentation. The majority of this coming from inexperienced practitioners using devices that are not FDA cleared, they're not getting proper training, or they're using devices I've never even heard of, although the patients think that they're getting a FDA approved or a trained practitioner's laser or microneedling device. So it's really important that you go to an experienced provider, someone that's board certified that does this. There are a lot of online copycats of lasers, HIFU, ultrasound technologies, microneedles. You really should not be doing aggressive microneedling at home. There's very high risk of infection, granulomas, dots on the skin, and scarring. I see people with scratches every day, and plasma energy is very dangerous in the wrong hands. This can burn through the skin. If you don't do this properly, if you actually touch the skin with it, because this device doesn't touch the skin, it electrically transmits energy from the surface via plasma energy. And if you touch it, you can literally burn right through the skin. So if you're doing this over the eye, if you're doing this sensitive area, you could poke the eye, you could poke through the skin, and that is going to cause permanent damage and scarring. So you don't want to do this alone, you don't want to do this untrained, and you need a device from a company that gives you reputable medical treatment. So this is FDA approved by Plasma MD, Plasma Concept. This is one of the best devices, the first on the market, so the OG of plasma energy, and that's what you want to use. The other thing too is as they've built their repertoire of providers, and as they've done more, there's now training programs. People are going to conferences like I'm at here teaching people on how to use this properly. And again, like I said, I developed my own skincare line to actually help the skin heal. I'm going to show today some pictures of what we call unexpected complications, sometime in darker skin type, hyperpigmentation, and some irregular discoloration that is actually expected to get the outcome we want, but treated with skincare and treated with sun protection, the right peptides and stem cells afterwards, you can get an amazing result without any long-term risk. So you do not want to use a copycat, and you do not want to do this at home. You need to get the OG of plasma technology, Plasma Concept, Plasma MD. So a lot of my clients are of mixed ethnicity, Asian or darker skin types. I did my training in New York initially, where all my clients were Black or Latin mix. Then I did my training, my fellowship in San Francisco, where all my clients were Asian. So I have been experienced and worked with many of the skin types that have high risk for hyperpigmentation, scarring, or even prolonged redness. And when we do treatments on them, whether it's energy-based like a laser or plasma resurfacing, and we expect some degree of hyperpigmentation or redness or inflammation, because that is going to produce collagen over time. That's how you develop collagen. That's how you develop skin tightening. We have a long conversation of pre and post treatment and the use of retinols, hydroquinones, my Emer Skin Aerify peel, all of the hyaluronic acid for barrier protection, and vitamin C as an antioxidant. We're also now upping the game. Rather than using occlusives, most people are using occlusives like a Vaseline or a petrolatum or an Aquaphor. We don't use that anymore. It increases heat and causes more hyperpigmentation. We use stem cells and growth factors and peptide creams and serums that help repair the skin and decrease the risk. So you may be an Asian skin type or a darker skin tone, or be a mixed ethnicity that will develop some hyperpigmentation, but we know that will occur, and we will decrease the chance by pre-treating the skin and post-treating it properly so that the skin heals. And you also, doesn't mean you can't do treatments if you're darker skin type. You just have to customize and go to somebody that really understands how to treat those skin types and pre and post treat them properly. You also have to plan out the procedures. You may not be able to do them as more regularly. You might have to do them in a prolonged interval, but you can do those treatments and get amazing results. When we first started years ago, the only laser we had was a non-ablative laser, and my best friend was Indian skin type. And we would do the laser, and she would be hyperpigmented for 3 months, and all we had was retinol and hydroquinone, and it would improve the pigmentation, and we would redo, and years later now she's a dermatologist with literally no scars and no hyperpigmentation. So typically almost all the hyperpigmentation that we would anticipate from a darker skin tone or that irregular discoloration or complexion irregularity, it will go away on its own over time, but it could take months and months. If we do the right skin care, we do the proper right of treatment and pre and post, then you can actually stimulate that to go away much more quicker in days to weeks. So we can treat every skin type.